Morning, everyone. Thank you for joining us today and welcome to the IDEX Healthcare Digital Series. I'm Shriyal Sethumadhavan, the Executive Editor of IDEX Healthcare. IDEX Healthcare has been creating thought leadership platforms for the global healthcare and pharmaceutical communities. We all have seen the success that over the last decades, our events such as Hospital Planning and Infrastructure Exhibition and Summit, Clinical Trials Congress, Pharmaceutical Outsourcing Congress, Aesthetic Medicine Magazine and events, Cosmetic Ingredients and Packaging India have all brought together thousands of healthcare and pharmaceutical professionals from around the country and globe to network, to share the latest in ideas and research, and do business. For our webinar today, Mr. Sanjay Seth, the CEO of Green Rating for Integrated Habitat Assessment, the GRIHA Council, and Senior Director, Sustainable Habitat Program, the Energy and Resources Institute, that is TERI, has joined us for an exclusive discussion on how we can make Indian hospital infrastructure more sustainable. Good morning, Mr. Seth, and thank you for joining us today. Pleasure to have you
Morning.
here.
Morning. Thank you very much for having me here. It's a pleasure to be here. Yeah, I think the health care sector is all that is these days in discussion. And it's a pleasure to be talking to you on this very important subject.
Sure. But before we get started, I would take this opportunity to introduce you with a few more words. So Mr. Seth currently serves on several committees constituted by the Ministry of Housing and Urban Affairs, Ministry of Environment, Forest and Climate Change and Bureau of Indian Standards, Ministry of Consumer Affairs, Food and Public Distribution, Government of India. Prior to joining TERI, he has worked with the Bureau of Energy Efficiency, Ministry of Power, Government of India, and led the vertical on building energy efficiency. He has also been the interim secretary of the Bureau of Energy Efficiency and has been responsible for the administration and financial management of the organization. By training, he is a civil engineer and has more than 32 years of experience in the power sector, both on the supply side as well as the demand side. Thank you once again, sir, for having you here. And just a small rule of instruction for all our attendees who've joined us today. At the bottom of your screen, you would see a Q&A box and a chat box. So for any questions that you have for Mr. Seth today, we request you to key them into the Q&A box. I would definitely take them up at the end of our discussion. And we are also open to having any feedback from you. So for any feedback for the IDEX Healthcare team, please key them into the chat box and we would be happy to, address them for you post this session. So with that, Mr. Seth, shall we get started?
Sure, yeah.
Yes. So I think in 2020, it would not be right for me to say that green building has been a new concept to India. So definitely we've seen, sustainable buildings and building green being like the talk for the country for a while now. So considering that you've been in, this whole field for a very, very long time, I would like you to begin with telling me that in terms of achieving a green footprint, where has India been and how has the growth graph been for the country over the years?
Yeah, so I think, if you look at the absolute numbers and if you look at our existing infrastructure, so let's talk about our existing infrastructure, which is there in place as of now. And it's not really, we haven't kind of put everything that is required. Maybe in the next couple of years, it's still to be there. It's only a small fraction of it, which is there currently. So if you compare to that fraction which exists, okay, so then we can say that, okay, we've done well as far as the green buildings is concerned or sustainable buildings is concerned. But if you look at the large amount of infrastructure which is yet to be put in place, then it becomes a very small, it's a minuscule. And seeing, learning from the global experience, I think we don't need to kind of reinvent the wheel. We know that this is an important way of taking forward our lives. We must try to optimize our resources as much as we can. We really don't have as a developing nation, we don't have that luxury and that flexibility of using resources the way we, very liberally. We can't do that. So obviously, it makes sense for us to be going on a sustainable path. We must adopt the path. And our past, if you see the way we have constructed, the way we have lived our lives, it's all around the central point of frugality, right? We've been we're not a very consumptive society by the way we have in the past. If you look at how our forefathers have lived their lives, they have been very frugal, and they have lived their lives in a sustainable way. The houses that we constructed and dependence on external technologies to kind of help us overcome the challenges of climate and weather and all of those things. I think we've done pretty well. But as we have started aping the West, that's where I think our problems have started multiplying. And we have now moved into, given the climatic conditions that we are in, we have completely thrown it out of the window. That forget about it. We are going to start aping designs from the West. So that's why you have a number of glass facade buildings and all of that, which probably may not be the best solutions in the kind of climates that we live in. And it's important that I'm not saying that we don't use glass at all. No, it's not that. But we optimize the use of glass. Is it that we need glass? We should use glass. And then the selections also. I mean, you have these days, technology has provided you a menu of options, right? Right from expensive options to the low cost options. So you're free to choose them and apply them based on your requirements. So yeah, I think so we still have a long way to go, and hopefully with the government playing its role, I think they are playing a very good role, and the policies, I think some of the policies of the government are by and large the best in the world, if I may say so. And we have seen them because I've worked in the sector even while the policies were being framed, and I was responsible for them. So we've seen them that they are some of the best policies, and there a lot of thought has been put in putting these together. But it's the implementation, and everything being thrust upon the government is not fair. I think we also, as practitioners, we also need to do our bit to make sure that we take them on or integrate it within our design practices as we move along.
Right. So taking from the point where you mentioned about, aping the West, that's become more like, our way of going forward in many cases. So would it be right for me to say that, green is all about localization? It's about using local materials. It's about designing, looking at your local conditions. So even, the kind of indoor air quality, space optimization, it's everything based on, your local area. So it's something that you need to know about your geographical conditions and also design when it comes to orientation and everything, rather than, just aping it from the outside as it is.
Yeah. I mean, this is common sense actually, but we've stopped using common sense completely. I mean, you look at, you go down south or you go to the humid areas. Why do people wear, they have a certain style of dressing. They use cotton fabrics a lot. Why? Because they are comfortable. The weather conditions don't allow them to be wearing anything other than cotton because it's very comfortable to wear. So likewise, when you're designing your buildings, you need to keep in mind the local climatic conditions, the locally available material. Those are available there, which you could be utilizing. And I don't understand that why should we be looking at regions outside of the region or outside of the country to be bringing in material just because it looks looks good. But something very good would be available within the region that you are constructing and where you're living. So, and our building codes and the guidelines of the various ministries do specify this, that when we are talking of the energy conservation building code, for example, which was there for commercial buildings, there it specifies, it takes into account the climatic conditions the building is located. So obviously, given that we are in, we are a tropical country, so our designs need to be such that our dependence on artificial lighting and cooling be minimized, and we can do it very well, right? There is enough sunlight in our country. but make sure that you cut out the glare. You don't allow the glare, the direct incident rays to come in. Don't let the heat to come in. And you could design a building, make sure that the glass usage is correct. Openings are of the right size. You have, interventions in design such that the incidental rays get blocked, and don't allow the direct incidental rays to come into your building. And then after have certain amount of ventilation and all that. So if you could integrate all of these aspects in the initial design stages, then I think it's a well-designed building will obviously lead to not only the feel-good factor, but also in terms of the health benefits. The way it's a no-brainer. I mean, it's a complete package where we enjoy everything once we have a green place.
True. Specific to hospital infrastructure, how do you see, the entire contribution of hospital infrastructure towards being sustainable and eco-friendly and complying to green norms in India in the present day?
So, hospitals, by the services that they provide, obviously are very energy intensive, right? And we all know that. So and especially given the pandemic right now that we are going through, we have seen that how various hospitals are working together with the government in, putting together isolation facilities, providing the health infrastructure. We require a large amount of it to be able to provide it to the huge population that we have. Now, hospitals, their core area of if you look at their expertise is about treating people, right? Providing healthcare to the citizens. Now, if their facilities start using resources, if they don't optimize the use of resources in their hospitals, then obviously it'll eat away, right? As it is, there is a lot of pressure on them to be cutting down costs and things like that, especially when healthcare is to be provided at affordable cost to people. Now, hospitals require to be maintained, the infrastructure requires to be maintained at certain levels, whether it is hygiene, whether it is temperatures, all of those things are there. Now, obviously, it becomes very important for them to be utilizing these resources very efficiently. And that is where I think the hospitals need to optimize. So energy efficient operations, make sure that the amount of energy that is used over the square meters of the building that they are operating under is optimized, and they don't use it in a way that it is wasted. And there is a huge scope of bringing down, optimizing it, and improving their efficiencies so that their bottom line in terms of, after all, electricity and all of that resources that they use come at a huge price, right? So if you are able to optimize all of this, then probably the amount that they spend on this phase or this part of their expenditure or spends would obviously help them to focus more on the sectors that they are required to, that is healthcare, providing healthcare to the people. So I think it makes a lot of sense to be for them to be going green. The design and operations, they play a very important role as far as how these hospitals probably can enhance their, the optimization that I talked about. Yeah, so many of the hospitals we have seen in the GRIA rating system, many of them, we have rated them, we've evaluated them, and some of them are excellent. I mean, the hospitals that are coming under the Pradhan Mantri Swasthya Suraksha Yojana, many of them are under the GRIA rating system. They have registered themselves. Many of the, the upcoming All India Institute of Medical Sciences that are now coming up. And then, of course, the private sector, the Fortis Healthcare, the Muthoot, the SAIL, various other hospitals, they have all come on board. Max Healthcare, all of them, I think they have all come on board and adopted the rating system so that they are able to, I mean, when we're talking about a rating system, it's nothing but a tool, right? It helps you to evaluate where your efficiencies are, where are the opportunities where you can improve. And once you are able to assess that and then integrate that, you become automatically much more efficient.
True, true, true. So, yeah, I had that in mind, for you to just tell us a little more about the Griha rating system and how it assesses the environment performance of buildings. So, typically, when a building registers under the Griha rating, I understand it's a indigenous, green rating system that was developed for the construction scenario. So, when a building typically, goes under a Griha rating, what are the various criteria that the building needs to abide to? Because I understand you all have like 5 ratings, 5-star rating being the best to
Yeah.
a 1-star rating. So what are the various green criteria that a healthcare structure would have to keep in mind when they go for a Griha rating?
No, so I mean, look, we have a point-based rating system, and what the rating system, there is no rating which has been created for different typologies of buildings. We don't do that.
Okay.
But we go in that we have different variants that our rating offers. So we have a Swagriha rating, which is a very simple and versatile rating, affordable, which does not require very intricate processes for someone to integrate efficiencies and resource optimization within their designs and all that. So that is one. Griha then, and then of course we've linked it to the square meters of the space that these buildings occupy. So the Griha is, for buildings which are up to about 2,500 square meters or less, right? So that's then greater than that, we have Griha rating, which is the main rating, which caters to a large segment of buildings, right from, and when I talk about Swagriha, so these are small buildings which could be residential buildings and smaller buildings. It could be also small offices and all of that. So they cater to that. The Griha rating then caters to a larger segment of commercial buildings and offices, corporates and hospitals, hotels, all of that. Then we have, of course, the large campuses, Now, typically, if there is a large development that's taking place, and usually large townships, all of that does not get constructed at one go. They do it in phases. So it's very important that while you are at the initial planning stages, and I think I would like to emphasize one point that when we are talking about what is the right time to be integrating, it's the initial planning and design phases when you need to integrate. Because if you are able to do that, then much of the worries and around the capital cost and all of them are taken care of, right? And you're also able to get it right in terms of what needs to be done in terms of site, in terms of planning, design, everything gets in place, right? So the large campuses then obviously, as I said, that they are normally constructed in phases. The initial planning stages, if the aspects of sustainability are integrated into the planning processes, then there is much better chance of you to be saving the environment from further harm, because construction is normally associated with a lot of harm to the environment right around you. So you minimize that damage that is required. So the LD, the Griha LD, the large development, there is a Griha large development which is there in places. Existing infrastructure. Now, once you have your infrastructure in place, it doesn't mean that you don't have an opportunity to make sure that if it was not constructed in the first place, based on resource optimization, then there is an opportunity for us to be setting that right. But then that is, of course, the last, that's the last option that you have. You should not probably look at that first, okay, let's go and go ahead with a design which is not really efficient, and thereafter we'll correct it once the operations begin. So that there is a limited scope where you can, you don't have a larger bandwidth for improving. So the existing building variant is there, which helps you to understand where the chances of optimizing, or where is it there the room for improving efficiencies are there, and then you through an audit process, and then you go about integrating various things in that. So that's the GRIA existing building rating. And then of course we have a very, for our young school children, there is a rating that we call rating for school, day schools that we came up with. And more than a rating, I think that was with the idea of inculcating the habit of optimizing or bringing in, helping our children to understand why efficiencies are important. And in a very playway method, we have brought in this rating so that they could do an exercise for their schools, see where their schools are in terms of their performances, and where do they stand in terms of the rating from on a scale of 1 to 5, right? So so that's a good way of, fun way of learning, as well as becoming more responsible towards this thing. And the GRIA rating, of course, as you know, has been, the foundations of the rating has been on the codes and standards which are existing in the country, the various guidelines issued by various departments of the government. And then those become the benchmarks. You don't have an option of saying that since I have abided by these codes and standards, I should be getting points. No, those are the minimum benchmarks. Now, if you do better than that, then that is when you get a point, or you get points. So it looks at site, it looks at energy, it looks at waste, it looks at water, all of these aspects. It looks at socio-environment, social aspects. Our rating is probably the only rating where enough, there is a mandatory requirement that you cannot play around with the health and safety and hygiene of the workers who are putting these infrastructures, together for you. And I think the present pandemic, we have seen a lot, which reminds us again that they are the main people who have helped us create this infrastructure, and you cannot ignore their safety and health and sanitation. So they are really at the, so those are things which, that's the basis on which our rating has been evolved. And then it has, it gives a lot of stress to the solar passive techniques and dependence. The systematic approach, the systems approach is kind of not encouraged. So you go with a good design and don't leave too much on the systems, right? That's the basic ethics on which we work. And then of course the underlying principles, this is my favorite line, which I say, that what gets measured gets managed. That's the, the principles on which GRIA has been developed. And it's very important that we continue to monitor our buildings. So we have at the initial design stage, during the construction, when we see closely that the design intent has been met. And then the most important element is that when you operate these buildings, they should meet the design intent. If it has not met the design intent and it is not operating as per the design intent, then surely there is some things which have gone amiss, and we need to kind of see, through an audit process, where is it that we have failed, and bring it back to normalcy. So those are, I think, the basic, I hope I have answered your question. That you
Yes. I think you even answered my following questions that I had in mind. But yeah, just coming to that. So there is an auditing process or monitoring process in place for a post-construction also to maintain all these green features, right? That are incorporated during construction. Because many a times what happens is we see that, they are applied during construction, like you said, put into the planning phase. And once the building is operating, so, you tend to not monitor these and you deviate away from all those green features that have come in. So is there a auditing process that, GRIA applies even after a project is constructed to ensure that the green features are being followed?
Yes. And that's what I said, when I said that the operation and maintenance is a very important phase.
Yeah.
Ratings are primarily, given once your building is operated, fully operational, and then we carry out an audit process. And then, the EPIs, the energy performance indices, or the various benchmarks that has been established at the design stages, we go and evaluate them and see that how much of it, how close are you to the initial design intent? Now, if you've not, as I said, that if you have not, if you find that the energy performance index was say X, and you're currently when we've audited and during your operations, you found that you are not X, but you are maybe X minus something, then we say that, plus minus 10%, okay, that's kind of allowable, because, normally, and this is what you theoretically design and what when you operate in actual, obviously the two will never meet, right? So there is bound to be a little bit of variation, but it cannot be very large, because if it is very large, then there is something wrong, right? So that's where you've gone wrong. So so that is, I think it's very important, and we do an audit every 2 years also. It's very important that we keep monitoring, and as I said, the cliche, that what gets measured gets managed. Very important that you keep monitoring your building, because people tend to say that, I have put in a very good design and it's bound to work properly. I have no worries now whatsoever, and I can kind of sit tight now on it. You are bound to go wrong, and if you carry out an audit and you see, and you will find that these variations happen, because after all, there are equipment outages, there are outages in the work, the buildings, they need maintenance, all of them need maintenance. So you need to make sure that the best way of diagnosing where the diagnosis is very important. So how do you do that? So you carry out an audit process, see where where it is probably there is room for improving, and then carry out the balances that are required.
So one is where, you plan say a greenfield project where you start from scratch, you build green. What about the existing infrastructure? So even like coming back to hospitals, you may have a lot of existing hospital buildings that were not complying to green norms. So is there an opportunity to, retrofit to be green as well?
Yes, we can. But then, as I said, there are limitations. When you are doing the initial design, you can play around with the civil design. You can play around with the systems. If you, for example, do your building envelope design properly, and you take care of the daylight integration, and you allow, make sure that there is not enough heat ingress into your building by using the right kind of designs and techniques. And so obviously your sizing of the lighting requirements and your cooling requirements will get optimized automatically, right? So that's, but that opportunity for improving the design is not available with you anymore once in an existing building. All you can do is probably improve your systems, right? Play around with your existing systems. So the HVACs and the lighting loads, those are, or the other electrical equipment that is operating, those are probably the only opportunities that exist. Of course, of late in a larger infrastructure, we've also started saying that if there is some amount of standardization that you can do in terms of changing windows and all of them, yes, you can probably do that. With a little bit of civil intervention, you would be able to do that. But then, of course, it will be at some additional cost, right? And
yes.
So existing buildings do not provide you the opportunities that are available with you at the initial design stage. It's very simple, but you can surely go carry out an audit process and then see where the opportunities for you to improve are, and then go about carrying retrofits. And then, of course, the key element there again is that you need to monitoring and evaluating throughout the life of the building.
So in many cases, we've seen, even in several interactions that I've had, with stakeholders, that building green is perceived to be expensive by the end user in many cases. So if you could just talk a little bit on what is this additional cost that is involved. And I also understand that there is a payback that comes along as well when you invest in a green structure. But if you could just throw some light about what is the additional cost and what are the monetary benefits as well in the long term when it comes to building green.
Okay, so this is, you're touching on something which is very close to my heart, actually. And I have always been, there is a word which I've used in the past far too many times, and I still would love to use it again, demystifying this myth that green costs more. And I still want to use this. And I did a full, every year we do a GRIA summit. And one of the summits that we did was, sustainable is affordable, and you could coin the phrase both ways. Affordable is sustainable, sustainable is affordable, right? Saying that sustainable is affordable, it is not expensive. And if you look at affordability and costs associated with it and sustainable, so it works both ways. I mean, that's what we did. We did an entire conference summit on this. And I tell you, we proved to everyone that probably if you go on a green infrastructure, and it's a no-brainer, you will end up saving initial capital cost. You will end up spending much less money. In a green building, the amount of reductions that happen in the energy space, for example, is anywhere in the range of 30 to 50%. Water, about 40% of your water can be reduced. Waste generation, that is reduced. So it's a win-win situation for all of us. All of this, and we are, if for far too long we have always put a very high price to electricity, but we have ignored water. Do you know? I mean, we are now completely, the water availability is completely stressed out, right? And there are now new what you call office memorandums, OMs being issued by the government, that you need to treat your wastewater, and some of it needs to be plowed back into use for various things, depending on the kind of the facility that it is. So wherever you're using a lot of green landscapes and all of that, how would you use this treated water to be using it for the landscaping and all of that? So there are these now directives of the government where you need to start using. So, and a building, I mean, we always think that, oh, why should I pay more, even if there was an incremental? For example, I would say, okay, that for the benefit of people, that, okay, green costs more. Okay, no problem. Let us assume for a moment that it costs more. How much more? 5%, 7%, something like that. Depending on the interventions that you make, let's assume that it costs you 5% more. For how long does the building stand? The norms that are specified by the government is about 60 plus years. That's the norm, right? More than half a century, right?
Yes.
And that 5% extra cost that you're going to incur now upfront will be recovered in terms of life cycle cost or paybacks, 2 years. Payback in 2 years, even if it was to cost more. I don't agree one bit that it costs more. I say that it costs 20% less than a normal building over the benchmarks. And again, I said that it's the interventions that you do. If you put in your initial designs optimally, right? You make sure that the designs are correct. There is no way that the cost will go up. And then it will keep paying you back. I remember that ad. I was in love with that advertisement when I was in the Bureau of Energy Efficiency. There used to be a ceiling fan which used to operate, and the ad showed money being flying in the air. As the air was being delivered by the fan, the money currency notes were falling out of it, right? Because that's a 5-star fan, and it's telling you that because you're using a 5-star fan, it is saving electricity and paying you. It's paying you rather than in terms of electricity usage. So when you have reduced electricity bill, so that's in a way. So you only know when you earn something or when you save something. So they don't want people. They never want to say, oh, because of a good design, it has led to me savings electricity of this much. So those kind of things. So it's very important, and I, for one, don't agree at all that green costs more. Now, look, initially, when these concepts were introduced, I would be receptive to the idea that when people would come and say that green buildings cost more, I would have bought that, and I would have said, yes, they do cost more. Why? Because those were the nascent stages of all of these things. You must allow the markets to transform, materials to be available in the market, and as volumes in the market, the demand aggregation models work, the prices automatically come down. And people it's a natural concept that people, the first drivers, they charge more, right? And initially the costs are high. But as and when their demand grows in the market, the prices naturally charges, because then they work on volumes. So all of that brings down the price. I am not going to kind of buy that and bite that bullet anymore, that green costs more. And then the most important thing is that as your building operates, electricity prices, we have seen, they keep increasing over time. You never, because you use less, you will always keep saving. So that's the mantra. So, I mean,
Sure.
I would, yeah, encourage people going green. Yeah.
Sure, sure. Also, speaking about government policies, we've always seen that government policies can play a crucial role in promoting sustainable development. So, are there any kind of incentives that say the healthcare sector or the stakeholders, the builders, architects, avail when they construct green hospitals or healthcare institutes?
Sorry, yeah, I got slightly distracted. Yeah, sorry.
No,
Tell me.
no, that's okay. I was saying from the government policies point of view, are there any incentives that healthcare
Oh,
institutes, so
yes.
those who
Not,
build?
I mean, yeah, okay. Yeah. So incentives, yes, those are very important. I mean, we also, when building codes were introduced for the first time, and we also, thought it necessary that in order to jumpstart the markets towards greater adoption of these codes, it's important to incentivize this sector. And what are the incentives that work? Normally, because developers they come and construct and they provide it to you, and something which they can benefit out of becomes the biggest driver for them to be delivering green. Okay, now you asked whether there are specific incentives for the healthcare sector. So healthcare sector, no, it's largely there, I mean, for the infrastructure. And for the infrastructure, what they do is that various, since this is a state subject and all of the implementation and compliance is at the other local bodies and at the state levels, at the subnational levels, that the state governments have come up with various incentives of going green. And they have directly drawn up a correlation with rating systems such as GRIA and LEED and IGBC, that if they are complying to one of these rating systems, then they would get additional FAR and other fiscal incentives, which the developer largely benefits. Because you see, after all, it's about the first cost uniqueness and the split incentives. The developer comes in, makes the infrastructure, sells it, and goes away, right? And then the occupier comes and operates it, right? Like you and me, we occupy those buildings and we operate them. So the developer does not find it value to be delivering green unless and until you and me demand for it, number one. And if he's incentivized, right? And the incentive is that if he's given an extra space, floor area ratio, the floor space, in addition to what is the norm, so then he benefits because he gets additional, amount of floor space to sell, and he makes his money out of that. So that is an incentive which a large amount of municipalities have come up with. And people were toying with the idea of maybe looking at rebates in property tax, or also looking at lower tariffs. But those would eventually, it would only be for us, for the building user to benefit out of. And so the builder does not find it value enough, in terms of money. And then of course, again, a favorite line of mine, that we need to demand green as users, end users. So if you and me demand green, the developer will eventually have to deliver green, right? So we start turning the market towards asking for green. That's the very important aspect of making sure we are able to scale up our infrastructure towards green.
Yes, yes. And I think in, the post COVID-19 world, it becomes even more important now for us to ensure that the buildings are safe. The building safety becomes very more important. In this regard, I would like you to speak about, there is an indicator that GRIHA has recently introduced, the Building Fitness Indicator tool. It's a tool to assess the safety and hygiene standards of workplaces post-lockdown. So at a time when, we all are getting back into our normalcy, and, we see clinics opening, we see healthcare facilities, opening, a lot of them that were shut during the lockdown period, and also that have been running with a lot of patient inflows also. Can you tell us how this tool will benefit? How will it help evaluate, and how adopting this tool can be, one of the stepping stones to lead a safe and hygienic lifestyle?
Yeah, I think let's understand this whole thing around COVID and the pandemic that we all are facing, and the virus is there. We all are going through lockdowns, working from home culture, and all of that has set in. There is a new normal, as they say, the way we are living, and some of us think that once once the lockdowns are eased out, the virus has disappeared. There is no such thing. The virus is still there. It's just that we are in a better state of preparedness to be dealing with the pandemic, right? So the government needed time to kind of educate people as to what safety and hygiene and social distancing and all of that is concerned. Now, as a result of this lockdowns that we have gone through, we've all ended up sitting in our houses, in the safety of our houses, and not going back to work. But the government has obviously, the economies have to be back in stream, and they have eased out, and people are encouraged to go back. Now, once people are encouraged to go back to their workplaces, every one of us, including me and you, I mean, all of us are worried about what is it that we do not know whether the place that we are going back to work is safe or not, right? So that confidence, we have suddenly lost that confidence. So we thought that in the Griha, as what we wanted to do is that let's do our bit to the community. What is it that we can do to help people understand the aspects of safety, hygiene, social distancing, all of that, sanitation. And we said there are guidelines which have been issued by the World Health Organization. There are guidelines which have been issued by the Ministry of Health and Family Welfare in India. There are other global and other guidelines, ISHRE standards are there on how to operate your air conditioning and all during the COVID times. So all of these things are there. So we said, why don't we educate the people at large that what is it that they need to do, and that the places that they are going to, how do we instill that confidence among their workforce that you are going to be coming back to safe environments to be working from, and you need not worry. But there has to be something which could be evaluated in absolute, in a way. There has to be, these are all tools and indicators which will be able to tell you that, okay, where is it where you lie, whether you are in the poor category or you are in the very good category. So there is a meter. I would want to remind everyone, including the people who are listening to this conversation today, that it's not a rating and it's not a certification program, but it is a tool. It will help you to understand the various guidelines and the standards that are there issued by various organizations, and based on those benchmarks, where is it that your organization fails? It will help you to evaluate, and it's a very simple tool which people can see that, okay, is there a policy which does your organization follow a policy of social distancing? Then if there is a policy, how do you make sure that it is being adhered to, right? So that, 2 gaz ki duri that they are talking of, or 6 feet of distance that we need to maintain between. So alternate workstations working so that you are maintaining social distancing. How do you make sure that your people don't assemble in, how are people who are coming from outside, how would you handle packets which are being delivered, or communications or envelopes which are being delivered to you? So various things which we have done. And that tool has been designed on that with the idea, simple idea, that there is going to be some amount of confidence that we need to instill in our workforces to tell them that your places are hygienic, they are safe places to be returning to work to. And here is a tool which we can use to evaluate it and let you know that It's good. I'm good.
Okay, so Griha
So
Supports is an
it's a building fitness
organization.
indicator. Sorry, yeah, it's a building fitness indicator, BFI. So it's there. I mean, we've got the link, and I'll be very happy to share the link with you all and
Sure.
encourage. And it's for free. We're not charging. There is no charge to it. People are encouraged to use it. Yeah,
Sure, sure. You could share that link with us and we could, share it
yeah,
with
sure.
our community so that they can benefit from it as well.
Yeah, yeah.
So as I come to conclude my questions and, everything that I had to discuss with you, a concluding message that you would like to share with the stakeholders of the hospital build and healthcare community sector.
So, I mean, there are two or three messages which I would actually want to leave. One is, of course, the underlying, the big message that we as end consumers need to demand for green, and that is where people will deliver green. So that's very important. And, by living out of green spaces, and when the pandemic and all of these things have taught us a lot, green infrastructure is a much healthier entity to be working and living out of. So, as healthcare facilities, it is more important that besides the hygiene, safety, and healthcare that they are provided, if it is a green infrastructure out of which that they are operating, it becomes even more healthier. It's the icing on the cake. So that's the other one. And largely, and the last point which I would like to make is that we need, as responsible people, that you all are also, after all, you all are people who are working on communication strategies. We are working on making sure that evaluating and making sure that the infrastructure that is put in place is sustainable over time, right? So as responsible people in our own fields, we must start the messaging about the green infrastructure needs to be corrected out there. So that myth, that demystifying that myth that green costs more, that's the other message that I would like to leave. So with all of these, if you see all of this, then with the resources being so precious and the optimal use of those resources will eventually not eat away the bottom lines of our core areas that we work in. So healthcare, say a hospital, for example, is required to make sure that it provides healthcare facilities for patients, right? It attends to the citizens at large. Now, they cannot be inundated, or their profits or their the monies that they spend on that should not become affected because their operations are not optimal. The resources, eating away their resources in terms of energy usage, water usage, and all of that should not be because of a bad infrastructure that they have in place. So I think these, if we all take care of all of these aspects, very soon we can be assured, we can sure of ourselves that the remaining infrastructure, the bulk of it, which is to be there in place, we will be much better in comparison to the rest of the world. So that's the message. And finally, of course, we all need to take care of ourselves. Let's stay safe. Let's stay healthy, and use the BFI tool once to evaluate our own workplaces in terms of its safety, sanitation, hygiene, and social distancing. Thank you very much.
Sure. Thank you so much. If our attendees have any questions, we would be happy to take them now. I can see a couple of questions with us. So Ashok Ambor has a question. Medical gas pipeline system is a backbone of hospital infrastructure, which has a lot of gray area on safety standards. In regulatory perspective, what should government and industry do to make hospitals safe?
So I don't, in terms of safety, that is something which I would not really want, because there are standards which have been set by the BIS. There are standards which are there as far as safety and all of these are concerned. These are standards that we would be largely focusing on sustainability aspects. So I would not want to obviously go into the area of safety standards and all that, because that's not our core. So it's best that we kind of avoid
Sure.
that.
Sure. Also, we have a question on how can Griha Council confirm strict control by the executing agencies over sustainable construction practices at site of various ongoing construction activities of any greenfield project by just carrying out inspections at certain intervals which are months apart. So I think
Yeah.
this is more
So,
during the construction stage.
yeah. So as I said that we not only, we evaluate the initial design concepts when they are submitted to us, we evaluate them. And then post that we have frequent visits to the site by our team, which keep evaluating. And it is very important that, during the construction stages, many of the things that are there in the design, they would be lost once the constructions are done. And it's important to be making sure that those are all adhered to, the ones that they mentioned at the design stages and in the initial submissions that they make in terms of documentation. So people do go frequently to the sites to evaluate that. And then even prior to the rating, during the completion of the construction, the site visits are conducted to make sure that all of those things that they had, that they had initially mentioned have been abided by in terms of the criteria that we mentioned. So there is a very set process that we have. We have standard operating processes for evaluating all of that.
Okay. A question from Ramanujam that we understand that GRIA has now come up with a new version, V 2019-2019.
Yeah.
From when will it come to force?
Yeah, so obviously, we are wanting the shift to the transition to be gradual. Most likely, we are going to make it mandatory from 21 January. Yeah, so we're giving time for people to follow the existing 2015 version till the end of this year, and then thereafter they move into the 2019 version.
Okay, so what is what is the upgradation in the new version now?
So it's more on aspects of life cycle cost analysis. So those things which we have brought in. It's also on, construction is a very evolving and a very dynamic industry. So there are changes in the way we construct the materials, all of that. So taking note of all of those, we've got the next version. Also, so far we have not given a lot of emphasis on the colder climate. So those colder climates have also been addressed in this new version. So it's I will not be able to tell you all of those, but largely these are the three main areas that I think we have. But we can surely provide you answers. We're coming up with the frequently asked questions and answers on our website. We encourage you to visit that and you will be able to find the comparisons.
Sure. So, yes, so I think that brings us to the end of the questions in the chat box. I see a few people greeting you for them joining us on this session. So thank you all our attendees for being with us today. Thank you, Mr. Seth. I think it's been a very insightful session. We've kind of gone through the entire journey of green right from planning to post-construction. And I am sure that this is a time when being sustainable is, paramount and crucial for the entire country's infrastructure. And healthcare is like the hero in this game for us, what we are doing right now. So I think this was a much required session, and thank you so much. Truly appreciate all the time and insights that you've shared with us today.
Thank you very much, everyone. Thank you.
Thank you. And have a good day, everybody. Stay safe and take care. We'll see you soon virtually with our next series.
Yes,
Thank you so much. Have a good day.
Bye.
Bye.